Hey, it's your girl, Nurse Coach Chelle, back with the second video in our Understanding Diabetes series here on YouTube and the Healing Nurse channel. This week, we will tackle type 2 diabetes, but just for a quick run through overview of what we discussed last week, which is the underlying causes of diabetes, which could be insulin resistance, not enough insulin being made, or no insulin being made at all by the human body, causing the blood sugar or the sugar within the bloodstream to get higher without actually converting and becoming fuel or energy for the body as it's typically supposed to do when the body is functioning in balance. In balance, not imbalanced, if that makes sense. It's balanced. Okay. So this week we're going to go over type 2 diabetes and how that is diagnosed and treated and all of the wonderful things related to type 2 diabetes. Not that diabetes is a wonderful thing. The good thing about type 2 diabetes, though, is that it's a little different than your type 1 diabetes because type 2 diabetes is really often linked to lifestyle. Unlike type 1 diabetes, which is an autoimmune disease, this is not. And what happens with type 2 diabetes is sometimes your body will get into a state where it cannot accept the insulin produced by the pancreas. So it's something called insulin resistance, or it's poorly used within the body. The and it excuse me, or it's insulin resistance and poor glucose use is what I'm trying to get out. I got stumbled over the words, but that's what happens with type 2 diabetes that is often linked to lifestyle. And the thing that makes it good compared to the type 1 diabetes is the fact that type 2, because it's linked to lifestyle, with lifestyle changes, you have the opportunity to not only improve it, but you could also reverse it altogether. Now, back to understanding the hemoglobin A1C, which is the blood test that gives a 3 month average of what one's blood sugars have been the 3 months prior to the test. With that, sorry about that. So back to with the hemoglobin A1C, remember from the last video last week, a hemoglobin A1C of 5.7 or below is a normal reading. You don't have diabetes if you are 5.7 or below. But then when you get into the to 5.7 to 6.4, that is what is considered pre-diabetes. And this is when if you are in this category from the hemoglobin A1C of 5.7 to 6.4 and you are considered a pre-diabetic, this is the most opportune time for you to begin those lifestyle modifications as well as diet changes, which would be a part of the lifestyle modification, because with weight loss, diet change, and activity change, you could pretty much decrease that hemoglobin A1C to below 5.7 and knock that prediabetes out the box, making you have a normal number. But if you ignore that prediabetes number and your number goes greater than 6.5, you are diabetic, and this is when they're going to want to start you on medication, and because you'll need that to help break down that glucose for energy for your body to be able to use it as energy. And if you leave it untreated to where your A1C starts climbing into the nines, 10s, 11s, 12s, and especially if that happens over an extended period of time, you run the risk of those other chronic diseases and situations that can pop up that I spoke about last week. And those things include nerve damage, which could result in something called neuropathy, where you have numbness and tingling, um, or diminished feeling in your lower extremities, in your feet, in it, or in your hands. And also, you run the risk of poor circulation, which would lead to that diminished feeling, especially in like the feet. And that is where what I was talking about last week, where you run the risk of developing wounds in those areas that don't often heal very well. And typically, if you are someone who is diabetic with a hemoglobin A1C that's really high, you're probably having issues with controlling how you're eating, meaning that you are consuming all of the wrong things, probably, or very close to all of the wrong things, which within itself is going to put you at an increased risk for heart disease and other like peripheral vascular disease, which leads to poor circulation in the lower extremities, which once again put you at risk for those unhealing wounds that could eventually lead to you needing to have your foot amputated or your lower leg. Those things can begin to happen. Other things that can happen regarding untreated blood sugars that are very high over time, that can lead to nerve damage in the eyes. So your optic nerve gets damaged and then you start to lose your eyesight. Some of these things are irreversible. Once the damage is done, it is done. There's not going to be a whole lot that they're going to be able to do to correct it. So it is very important to try to stay on top of these things and deal with them right away instead of just ignoring them and going on about your business, because sometimes what will happen is I've witnessed this time and time again where a patient will have these situations and then they just let it go and think nothing of it. And then all of a sudden, all these other chronic diseases start popping up in their life. And now they want a miraculous something to happen to reverse it. Well, the damage is done. There is not going to be much reversing of a lot of these things, including kidney damage, which is also related to the nerves. It can lead to kidney failure, where you could over time need hemodialysis or need a kidney transplant. Um, it also puts you at an increased risk for heart attack and stroke. So, as you can see, diabetes is more than just blood sugar. It is a big, major disease that impacts your entire body, the whole thing. And like I said when I started this, the great thing about type 2 diabetes is it has the potential to be reversible. The diabetes itself. If you've allowed your diabetes to go unchecked for extended years and now you have these other situations that are going on, those things are going to be irreversible and really not worth it if you really want to think about it. So it's best to try to nip it in the bud in the beginning instead of waiting for later. I don't know what the wait would be for, but I get it. You know, life gets busy. A lot of people are in denial about diagnoses that they may get. They may say, "Oh, I feel fine," and just think that they can just go on about their life. But I can't express this enough that if you are told that you have a 5.7 hemoglobin A1C or higher, doesn't matter how high up it goes, that is when you really should take this seriously and start looking at ways to reverse these symptoms or these conditions so that you don't end up getting to the point where you're at those irreversible situations. Um, Now, common treatments for type 2 diabetes is typically medications. Oral pills is usually what they start with. And the main one that they usually will go to is metformin. And what metformin does is it reduces your glucose production in your liver. Metformin is cost effective and it is the most commonly drug used. There are other options though that are out there that they do go to if they're not getting the results that they need from the metformin. Sometimes they need to add insulin. Other times they can provide you with other medications to help with diet control, or control of your appetite, as well as controlling the blood sugar and also helping with weight loss. So drugs like Ozempic or are is one of the most common ones that is being used right now, even for people who don't have diabetes. It's being used for that, to help with weight loss. But with all medications, there's also that risk for those unwanted side effects that could result from these drugs. That's why it's always best to try to do treatments holistically as long as it's safe to do so. Or incorporating holistic methods in addition to those medications, so that they can try to work together to get you back on track. Some other things that they may use, helps remove the sugar from your blood in other ways, like through your urine and things such as that. So, but yeah, there's other medications that they also use to help manage your blood sugars, like glipizide, glyburide, Amaryl. Um, in some of these drugs you may or may not have heard of, Trulicity, Victoza, all of these, Monjaro, all of these help manage blood sugar. The Ozempic, Trulicity, Victoza, and Monjaro, those are those medications that help suppress your appetite as well as help you lose weight, which is very helpful in a type 2 diabetic, especially if weight is a factor in your disease development. Um, I'm not going to go through all of the medications, but there are quite a few that are options. And if you are at all, if you are a diabetic and you are at your wits' end, or you just want to try something different because you want to get off some of these medications, if you can, book a 30-minute discovery call with me and we can set up and talk about everything that you have going on medication wise, disease process wise, and come up with a blueprint to help in conjunction with partnership with your actual provider to come up with a blueprint that could work for your lifestyle and help you decrease the medications that you need, as well as the symptoms you may have, as well as the higher blood sugars that may be impacting you. So the link is, in the description below, but check that out. Book a 30-minute free discovery call and we can go from there. Because healthcare is so individualized, it's often better to sit one-on-one with a practitioner or provider or nurse or um, whoever you get your healthcare information from and go through everything. Like I said before, everybody's unique, individual. Everybody's different. Their body is different. Yes, there's standards across the board on some things, but it's still going to require tweaking in some places due to each individual person's uniqueness within their system and their makeup. Now, last week I started talking about some supplements that are helpful for diabetics. But again, you'll want to check with your healthcare provider and ensure that these medications will not enter, or you can check with your pharmacist too, to ensure that these medications or these supplements do not interact with your medications that you're currently on. And we can talk about those things too. The information I'm giving now, again, is just broad information. Everybody's different. But some supplements that could be used to help with blood sugar regulation or help with insulin sensitivity, also with nerve support, things such as that would be like cinnamon, berberine is good, magnesium is also a good one, just to name a few. There's also vitamin D3 that helps. Omega-3 fatty acids like fish oil is very helpful. Zinc, probiotics, all of those things can help because it not only works on the blood sugar, but some of these things also work on your gut health, which is very important in overall health. If your gut is unhappy, everything else is going to be unhappy as well. So making sure that you have good gut health is going to be extremely important. And with that comes good diet choices, good meal choices, staying away from those higher inflammatory foods with empty calories, chips, cakes, sugar-based things, sodas, pops, juices, fast food, high carb things like white bread, pastas made with the white wheat, or excuse me, with bleached wheat is what I was trying to say. Unlike like um the pasta made from whole grains, which would be way more healthier than regular pasta that you can find for $2 for a box. healthy eating is a little more expensive, but you pay a little bit more now versus paying a whole lot more later due to disease development from poor diet choices. So you got to kind of weigh which one's more important. Which do the pros outweigh the cons? You pay a little bit more at the grocery store today to get healthier foods. I know it's hard right now. Don't get me wrong. I get it. If you can't afford it, you can't afford it. Everything's high, high inflation. Everything is just extremely expensive. And if it was expensive to eat healthy before,